Welcome to Sage Women, the podcast for midlife ladies navigating perimenopause, menopause, and healthy aging. I'm Melanie White, and each week I talk with experts and women sharing real stories, practical insights, and smart tips to thrive through this stage of life and beyond. It's Melanie here on the Sage Women podcast, and I'm really pleased to introduce Celeste Cleary, who's the founder, head honcho, key change maker, whatever you want to call her. Many exciting titles from Flourishing Wellness. Celeste, thanks for being here today.
Hi, Mel. Yeah, great to be here. Thank you for inviting me.
I was really pleased to have you on this episode because I know you have a really interesting background and some really interesting experience and insights working in regional areas here in Queensland. And so talking about some of those things today would be really fantastic.
Yep. Sounds good. Sounds good.
Now, I know that you love talking about yourself, as most people do, but I always like to start these sessions with a bit of backstory about you, your professional journey, your personal journey, something that you might like people to know about you, how you got to where you are.
Okay, so my background is in nursing. And so I've been a nurse for over 30 years now. And a few years back, I was feeling that disconnect from, the misalignment with values and so forth, and found my way into coaching and feel like I can have much more impact helping people make the change they want to make in coaching than as a nurse, although I still use my nursing skills and I still like working in a team from time to time as well. So it's a nice little refresher to go and do some casual shifts here and there. And I've found my way into workplace wellbeing, and that really aligns for me because I feel like I can have way more impact with a group of people and helping them, in a workplace than just individuals. So I still love my one-to-one coaching and find that quite energizing, but it's really satisfying and really inspiring seeing the changes and the ripple effect that people experience when they come to my workshops and stuff. So have I given you enough background? I've lived in Queensland a lot of my life, but I still go for the Blues because state of origin.
That's not real football, Celeste. Sorry. I'm going to lose followers saying that, but AFL's the only code. Sorry.
Oh, well, I get into that, but for the Queenslanders, it always G's them up.
Actually, it was interesting. I was having a conversation with someone last week talking about how sport really brings people together in communities. And I suppose everyone loves some form of sport, but
Yeah.
I don't know about you, but I really find that there's a very strong pull towards community sports and sport in general in regional areas.
Definitely. It's an opportunity to bring people together. You don't see your neighbours on a regular basis. So particularly when you are out of town, but even living in town, it's a small area and people are prepared to travel to catch up and have that social connection. So and I think with children's sport and stuff, it's a universal thing that brings families together as well.
Mm. Which region are you in, Celeste? Are you on the coast? Are you in the interior?
Yeah, I'm in central Queensland. So Rockhampton is it's probably only a 40-minute drive to the coast. But we're the centre of our health service district, and it goes as far west as like Emerald and then up north a bit. I'm not going to outline the whole district now, but it's like, 3 or 4 hours drive circumference around here. So there's quite a few areas within that are a long way from, from a major centre. They could be 3 or 4 hours. So to receive specialist care and stuff, I do some work with breast screen, their assessment clinic. So we have our mammograms, our screening, and that eliminates a lot of healthy people who have no problems. But then the people who we can't eliminate, is having normal tissue or normal images, then they come into an assessment clinic in a regional centre like Rockhampton. And so some of those ladies are travelling 3 or 4 hours to come to an assessment clinic. So it's a
Wow.
big deal, and they've got children. Often they've got teenagers. Some of them have got younger children, and so to wrangle the family and get themselves to that
Wow.
clinic for a day is, takes a bit of logistical, yeah, planning. And I think it's that can be said for all healthcare associated appointments and stuff. It is quite a, it takes a bit of planning and organising for people.
Yeah, I guess we think about the travel time and the cost as well, but because you don't have a specialist in town. But then, as you mentioned, there's also what do you do with your family? You can't just
Yeah.
leave your 3-year-old at home to fend for themselves, can you? So then you've got to
No,
coordinate family to come with you or to be looked after.
correct.
And I suppose then if you're going into town for something like a mammogram, you might say, well, throw another log on the fire. While I'm here, what else can I get done?
Yes,
And it becomes
yes,
this, how do you coordinate all of those appointments so that
yes.
you're not coming and going all the time?
Yes, that's right. And people do try to do that wherever they can. And sometimes like something like an assessment clinic, it's like once you've heard you've been recalled, you kind of want to get on it and get it sorted, before too much time gets away. Yeah, so it's quite a thing. I notice it particularly for our ladies having babies, sort of that, like this is the other, earlier part of the lifespan, but
Yeah.
you've got 2 or 3 kids, and then you're having a baby and you've got to go 3 hours drive to the nearest hospital that can offer that service to support, to have maternity services. Yeah, that's really tough. I mean, babies don't book in to come to arrive.
Yeah, true. Yeah. Oh,
Yeah.
gosh.
So you could be waiting for weeks. Or
Yeah.
yeah, you could get caught out. So that there's quite a bit when you're living in a regional area, I understand. And I think that's universal. It's not just here in Queensland. So um yeah, but it's still got lots of pluses for it.
Also the same where I am in regional New South Wales. And we're having a new hospital built. Our local obstetrician gynecologist became an MP and championed for this hospital to be south of me in Maria, and 30 minutes north is Batemans Bay from me. And
Mm.
that hospital's closing so that
Ah,
this other one will open. So there's a big furor about will it be, what happens if there's a bloody crash? Is signs around here? Where do we put the hospital so that it services the most people? Many of the hospitals around here don't have facilities even for things like an open fracture. So the
mm,
nearest is to go to Canberra, two
mm,
hours away up a big hill, either by
mm,
helicopter
mm.
or
Yep.
ambulance or car. So yeah, I can't imagine being pregnant in a regional area or having some excruciating, painful, difficult women's health issue that needs
Yes.
specialist care that you don't have access to.
That's right. And it's the universal thing in Australia is that access to care and access to services, and distance is a big barrier for a lot of people. And I think affordability is also becoming a barrier. And it's not just affordability that you can't access private, and therefore more timely services, but it's also simply paying for, the ability for the transport to get you to the centre, and then accommodation and, all those things that goes with it. It's, yeah. But anyway, I'm digressing.
No, it's all relevant. I mean, we need to really understand if we're going to make any sort of change and improve access and quality of care for regional women, we really need to understand some of the details of those challenges because
Yeah.
otherwise we don't know specifically which problems we need to solve. And I know there's a lot of conversation around this, but
Yes.
hearing lived experience is really important. So
Yes.
I
Yeah.
guess from your point of view, Celeste, is there a particular area that you think is underserved in regional Queensland?
I think women are needing that women are the backbone of communities in rural areas, and it's your family unit, it's your extended family that could be around you and your friendship group, but it's also your community. And so there's a lot that there's a lot that's riding on women's health and well-being. If they're not well, if they're overwhelmed, if they're, you know, trying to keep all those balls in the air, then, you know, that has quite a ripple effect. So whether it's in terms of their, you know, managing menopause symptoms, recognizing them, and others around them being able to recognize it so that they can support them with compassion, then there's more. Yeah, I'm sorry, I've just lost my train of thought. Yeah,
I think you're talking about the need for support.
yes, yeah, I think so. This is what I'm seeing. I attended the Queensland Regional Rural and Remote Women's Conference last month, and yeah, there's quite a there's this real keeping the front up, and we've got it all together, and we're resilient in the bush, and all those things, which people are, and it's amazing how resourceful people in the bush are. But there's also this. Sometimes it's hard to have a safe place that you can just like, hey, I'm really struggling here. And I believe there's a lot of people who are struggling underneath, but they feel that they need to be putting out that they've got it all together. And it's not just a social media thing. I helped with Blaze Aid volunteers when we had bushfires in an area. It wasn't the fires, it was floods at that time, in a community not far from Rocky, and we were helping with the catering. So when the volunteers had come in every evening, someone was on duty for feeding the multitudes. And what I found from conversation is that people were saying that the volunteers had gone to help the people on the land, on the properties, and the landowners actually had, like, they were feeding their animals before they're feeding themselves. And no one else would be aware of that they are really suffering. I see people that are really suffering, but they don't want to either impose on someone, or they see that others' needs are greater, and so they sort of keep their cards really close.
I guess from what you're saying, there's a real resourcefulness, and I suppose you develop that as part of living on the land and having less access to things and having a harder time of some things. And then that attitude is also a barrier for getting timely help, perhaps, because the brave face is your norm. There's almost a culture of the brave face.
Yes, yes.
And then, as you say, people don't want to talk about hardships necessarily. And it's probably a bit depressing, really, to talk about hardships too. So let's talk about what's working well. But is that then excluding an opportunity to get much needed support in a timely manner?
Yes, yes, yeah, yeah.
Yeah, very interesting, Celeste. I'm just wondering, in your work in a kind of a more of a hospital or healthcare setting compared to a workplace setting, how are the attitudes around health different or similar? So think about patients coming into a hospital or looking for care and their attitude to health versus going into a workplace and talking about health and well-being. Is there a difference?
Yes and no. So there's a theme that I'm seeing, and it's not just in healthcare, and I'm not sure exactly what's behind it. I could speculate, but I'm sensing a growing sense of disempowerment, or it's like this feeling like we don't have control over our healthcare. We come into hospital and it's like we want to hand it over. Someone else can manage it, It's that people are easily overwhelmed, say in a workplace. It's another change. It's like, and there's the pushback. It's like, I can't deal with this now. I don't want to deal with this. So whether it's our health, whether it's in our job, whether it's like, I mean, I just had Facebook do something weird to me a minute ago, and I was trying to put a post up, and I'm thinking, oh my God, it's like,
Yeah.
not another thing. And so I'm not sure. And I feel like we have things that are put in place to, we have diagnoses and so forth that are to help people access resources so that they can feel empowered to manage their, attention deficit, or their, if they're on the spectrum with an ADHD and all these kind of things. But it's like somehow we get the title and we put ourselves in a box, and then it's like, I can't do that because of this. I have this thing,
Yeah.
my anxiety. It's sort of this
Owning the label and becoming the label, becoming
Yes,
helpless almost.
yes. There's this learned helplessness, I guess we could call it. So that's what. Yeah, I love that as a coach, you get to sort of ask those curious questions and ask people, well, what's another way that maybe we could be looking at this? What's the opportunities in it to help them to see that actually you can rise above this. So the difference in a hospital setting is that I see way more people who don't want to or can't see how they can drive their own health and well-being.
Wow.
So I say no one cares more about your health than you do. But still there's this, like, I don't know, it's just like, it's almost, I can understand the rawness of emotion, particularly in an emergency department situation. It's like you want to blame, you want to do all those things, and you see people behaving at their worst, and it's all driven from that fear. But it's more than that. That's the acute thing. But underneath it is like, I can't manage this. I need you to do it for me, or I want a quick fix. And that wore me down in nursing. I just thought, I can't do this for you.
Yeah.
I can help you in this situation, but it's this ownership. And I think in healthcare, we're becoming more and more specialised. So we've got the people that look after the kidneys, and the people that look after your heart, and people that look after your brain. And, if it's something that's in the middle, the poor old GP, they're trying to look after a whole person. And we've got a patient who's not really engaged with the process. And, you can sort of feel like not a ping pong ball, a pinball, getting flick, 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 flick around the table from one specialist to another. Because it's like, you go to the heart specialist, they say, well, it's not my thing. Back to the GP. And then, the next specialist says, no, it's not my thing. So like, who's looking at the whole person with that, that real, that holistic perspective. And our GPs are so flat to the boards that it's really challenging. And it's, like we'll get the answers, we'll find the answers. I firmly believe that. But I think we're going to go through some discomfort to get there. And I think we all need to step up for our own health and well-being and start doing the heavy lifting, because the system's not going to be able to contain it forever. Like, we can't keep going the way we are. That's what I firmly believe. So we'll get there. We just have to.
Yeah. It's a really interesting perspective and a lived experience perspective that you have, Celeste. And I think I'd like to pick up a couple of points that you raised. And
Sure.
at that kind of the higher level is, firstly, there's obviously systemic barriers.
Yes.
And one of those is distance.
Yes.
And one of those is attitude, or socio-cultural aspects and beliefs and
Yes.
norms. And one of those is the siloing of healthcare. And all of those things probably feel, and possibly also the blossoming of specialization.
Yes.
Feels very overwhelming to an individual,
Yes.
such that perhaps some focus areas might include helping people to learn how to advocate for themselves, What questions do they need to ask? How can they feel
Yes.
confident in putting themselves forward? And how can they actually get the support that they need?
Yes. Yep. And I find that's what I'm doing a lot when I'm in an assessment clinic in breast screen is helping the ladies to, or even if it's preparing to come, it's like, this is what you can do. And if you've got any questions, write them down and bring them to the clinic with you, or have them near the phone so that you can ask when it comes up, because you're going to be, going to have the tunnel vision at the time. And
Yeah.
just prepare people. And it's normalizing it. When we're suffering, when we are struggling, we get that, it's the whole, adrenaline, cortisol response, and we get the tunnel vision that goes with that. And we think we're on our own, and we're not. Like it's normal. And I think the more we can help people see that, yeah, this is a normal response. You should be a bit anxious about this, because this is getting you to be, your antennas up, ready to take in information, ready to respond to the situation that you're in. So let's just, like, it's not you're anxious, you have some anxious thoughts, and that's normal. So I'd be worried if you're a bit
Blasé.
if you were
Yeah.
blasé, I'd be concerned, So
Yeah.
and I think that helps to put it in perspective for people.
Mm. How important, I've got some questions around solutions, of course. How
Yes.
important is education for regional areas? And also, the other part of that is there a role for technology and digital health services or apps or
Yeah,
those kind of things?
absolutely, 100%. And even the AI space as well, and technology. Like, I'm seeing service here in Rockhampton for doing like heart surgeries and stuff. And I'm not talking about like major, like bypass surgery and
Yeah.
stuff, but at least doing angiograms, and it will expand on that, and having guidance for surgeons from Brisbane, so they can actually telehealth in to the operating theatre and help guide a procedure
Wow.
for a surgeon who's just needing that support. It's really helpful. We've got a lot of now that we're a hub for uh, like UQ, and we have the undergraduate doctors that are in our midst so that they can study without having to be in Brisbane. We're getting a lot more like teaching, like medical practitioners with that teaching, approach. And so that's all building the richness of knowledge and skills, and hopefully helping our remote practitioners to feel supported, and for junior doctors to feel like that's something that they could do, that they would feel supported to be in a regional area working, because there's such a shortage of
Yeah.
health staff in regional areas. And we can have wonderful new hospitals built, but if we don't have the staff to make them function, well, it's not worth anything to the population. So I think technology is definitely a thing, and we use it in breast screen for we use telehealth to give results, and that's really helpful for a lot of women, because they don't have a GP in their local town. At best, they are able to, we can send results to that particular clinic, and they'll see whoever is on duty or whoever is the doctor at the moment in that town. But to get results, they would much rather come and see us, or either in person or by telehealth, so that they can get those results from people that they have a rapport with.
Mm.
Mm.
And I don't know if you know this, but what is the uptake like from consumers, from women living in regional areas, of things like health apps and telehealth clinics? Is it something that is easy for them to
Mm.
do? Are they mobile phone users, or are they kind
Yes,
of?
a lot are. Oh, yes, yeah. I think you've got to be savvy with the technology these days. I think there are more women that are running businesses from their farms. Like there's the farm business, but they might be like doing travel or I say travel because that's my cousin's wife is a travel agent. She was in Sydney and then they moved to she married and moved to the farm. And so she's running her business and that requires really good internet. A lot of people are doing all kinds of interesting things and running podcasts and whatever from home. So they're definitely tech savvy. Yes. And
Great.
I think, if we're talking about rural businesses, they've had to be really efficient to stay in the game. So they're always they're proactive to adopt new information, new technology.
That's wonderful to hear, because I've had some conversations with people saying that regional women maybe don't use technology as much, don't use apps, aren't connected to the internet, or have troubles with connection, or don't really use computers very much. So I was curious to get your take on that. I suppose it might depend on the region.
Well, that's true, Mel, and demographics as well. So, I see some really proactive 75-year-olds that are, right up there. They're on Facebook, they're on, they're doing all kinds of stuff with technology. And then I see 50-year-olds or younger that don't have much to do with it at all. So there, I guess there's exceptions to every rule, but I think access again to a good signal. And since the 3G was put to bed last year, we've certainly noticed a difference in the service out at our little farm that's about an hour out of Rocky. It's quite incredible, the difference. So we're looking and hoping that that's going to improve, this is what we've been promised, with getting rid of 3G so that there's bandwidth freed up, as I understand it. And a lot of people are talking about Starlink and different internet services to get better signals and better communication.
Yeah, it's an interesting point, isn't it, that women's health might depend on internet connectivity, or that might be a big part of it, because you're talking about that as an enabler for doctors, for health professionals, for women to access information. And as you were talking, I got thinking about what you said earlier about, I kind of asked you about the priority, and you started talking about connection, people coming together. And as you're talking about people being on Facebook, I'm thinking perhaps if you are on an isolated farm or property 4 hours from the next neighbour, why wouldn't you be on a social media network?
Yes, yeah, there's a lot there. But I was thinking, because I know the time is slipping away, and I did do a bit of reflecting on what other services are available around the area that I know of. And as far as spreading the word about women's health and, menopause information and so forth, the Queensland Country Women's Association is enjoying a renaissance at the moment. So we've had actually a new club open up in our area, and I've talked to the ladies down like where our farm is, and they're quite active down there as well. So and there were representatives at the conference that I went to back in June. So there's definitely that's becoming more connected, and it's rejuvenating itself to be relevant for today's rural women. So so that's definitely an avenue. And we have the it's called True Relationships and Reproductive Health, and they are based in regional centres like Rockhampton, Toowoomba, I think Mackay, and probably Townsville, but they do outreach as well. And they go as far west as Thargomindah, which is about as far west as in south as you can go, and then up to Julia Creek and Hewenden, and towns out to the west, and that's in the north. So they have a website. People can jump on there and they can make an appointment. And I don't know how frequently the outreach services are, and it was probably depend from town to town, but it's a great service. And I think I was at a gathering recently, and I I was aware of this organisation, but the number of ladies who are my age and menopausal, perimenopausal, that were not aware that True existed, let alone that it provides support for menopause. So they've got really great nurse practitioners, nurses, doctors involved there. They do way more than just, helping teens to access contraception and, things like that. It's really a great service.
Thanks for those links, Celeste, and I'll add to the mix Quendo, Queensland Endometriosis, that offers free telehealth clinics, which is an amazing service, and a lot of online support and an app that they have.
Wow.
And yeah, they're really incredible. And I'll also mention Ovum, and by the time this episode is published, they will have gone live. Developed by a medical doctor, a women's health app, and it's absolutely incredible. You can type in what your symptoms are or what you're struggling with. It will give you an answer, and it will even ask, would you like help preparing questions to ask your doctor?
Oh, that's excellent. That's gold.
It's a really amazing app, and I can't wait for people to have that in hand and to.
Yes.
It's just going to. It's affordable. I think it's like just a low cost app from the App Store, but the power of that, and it's no more Dr. Google. It's based in medicine, written by a doctor for women and women's health. So lots of great opportunities for women to connect with services.
I love that. And that encouraging questions and getting people percolating ideas so they're actually thinking about it instead of like pushing it away because it's like, I don't know where to start. It's like a lot of things, isn't it? If you don't know where to start, it's hard to start chunking it down.
Yeah, you got to get over that first hurdle.
Yes. Yeah.
Celeste, thanks so much for your time today. I wonder, do you have any parting thoughts from your experience of women's health or workplace wellbeing? Is there one takeaway that you would like to share with people listening today?
Something I'm involved in a lot with my coaching, and I've actually got a workshop around it, is around having tough conversations. And I'm finding that when people have the tools and the skills to sit with the discomfort of how it feels to be like, how's the person going to react? How's this going to go? I don't know. When they can just sit with it and have some simple tools to navigate it, it's like the ripple effects are unbelievable when you can find your way through that. So I just encourage people to just sit with that feeling and then ask yourself, now what? Okay, now what can I do? Who can help me to move forward in this?
I love that, Celeste, because it's really the first step is being able to do that. And I hope we can share a link to that workshop that you deliver and let people know about your services, because if people aren't able to find a voice and speak up to advocate for themselves, they need to know how to handle their situation. So it's a fundamental skill. So thank you for sharing that. And thank you for your time today too.
Yeah, thanks, Mel.
Great to see you, and hopefully we see you again sometime soon.
Yes, likewise.